Welcome to Empowered Motherhood, Fertility, Pregnancy, and Parenthood for the Modern Mum. Today, I am going to chat to you about the term infertility. And maybe you're here because you've recently been met with this diagnosis at your doctor, or maybe you're a little bit concerned that infertility might apply to you. So let's take a look at what infertility really means and what other terms I prefer using instead. So the word infertility, it tends to get thrown around quite a bit in conception. And psychologically and emotionally, it can be a really tough word to get your head around. So I wanted to take a look at what infertility really is, and like I said, that terminology that I prefer to use. But the definition for infertility does change a little depending on what country you're in. Let's have a little look at what that means. So there is a clinical definition or a series of clinical definitions. The World Health Organization, for example, they say that infertility is a disease of the reproductive system defined by the failure to achieve a clinical pregnancy after 12 months or more of regular, unprotected sexual intercourse. So pretty straightforward, 12 months of time without getting pregnant. Medically, it's also clinically defined as the ability of a sexually active, non-contracepting couple to achieve pregnancy in 1 year. Okay, so you've got that 12 months again. Demographic definitions of infertility, often used in research, is an inability of those of reproductive age, so 15 to 49 years of age, to become or remain pregnant within 5 years of exposure to pregnancy. An inability to become pregnant with a live birth within 5 years of exposure based upon a consistent union status, lack of contraceptive use, non-lactating, and maintaining a desire for a child. Okay, so a few more kind of like emotional concepts in there. Epidemiologically, you can define infertility as women of reproductive age, again, 15 to 49 years, at risk of becoming pregnant. So they're not pregnant, they're sexually active, they're not using contraception, and they're not lactating, who report trying unsuccessfully for a pregnancy for 2 years or more. So, as you can see, there's quite a few different ways that you can look at the idea of infertility. However, the key here is that they're all defining a period of time between 12 months and 5 years that someone is trying to conceive and not becoming pregnant. Interestingly, some of the definitions specify live birth, which could be interpreted that the woman is able to become pregnant but not carry full term, resulting in miscarriage or a stillbirth, right? This can also be seen when we look at causes of infertility. So we have what's called primary infertility, and as that suggests, this is when a woman is unable to ever bear a child, either due to the inability to become pregnant or the inability to carry a pregnancy to a live birth, right, to have a live baby. So here with this, she would be classified as having primary infertility. So medically speaking, women whose pregnancy spontaneously miscarries or whose pregnancy results in a stillborn child without ever having a live birth would present with primary infertility. Okay, so again, you can see this word infertility, it's not as cut and dry as we think. Secondary infertility is where a woman is unable to bear a child, either due to the inability to become pregnant or the inability to carry a pregnancy to a live birth, following either a previous pregnancy or a previous ability to carry a pregnancy to a live birth. So those who have previously had a child or been able to conceive and carry a baby, but then subsequently had multiple miscarriages or trouble conceiving, would be classified as having secondary infertility. Now, what I've just talked about are the medical definitions of infertility, or those used for research purposes. They're quite heavy in wording and very specific in what they're looking for. So the big question here is, how useful are they when it comes to working with a client. Is it useful to use the word infertile when discussing conception with a couple? I think you know the answer to this. So the term infertile, to me at least, can seem so finite and concrete. But what we need to remember is that clinical definitions refer to one point in time. They're a snapshot of someone's fertility at that moment, not a look at their entire fertility lifeline. All right, so what might happen at different points along their fertile journey. Infertility, it's transient. It's not this foregone conclusion that these definitions seem to imply. The only time that we can really say that someone is actually infertile is when they've either gone through menopause and completed menopause, or have a physiological condition such as having no ovaries or no uterus. So a better term, and one that I really like to use, is subfertility. And that is to say that your level of fertility sits outside what we'd consider the clinical norm. And for most places, that definition is to not be able to conceive within 12 months. That is considered the clinical norm. So infertility seems unchangeable and final. And subfertility, it gives hope. It says that there's something within your control to change the outcome and move forward. So next time you get hit with that word infertility, just remind yourself that unless you're missing reproductive organs or you've gone through menopause, subfertility is a much better way of defining your fertility status. And with that, I just want to say thanks for joining me. If you want to get an insight into how you can improve your fertility, I have my really fun, really informative webinar session running. It happens once a month, and I'm going to go through the 5 key areas of female fertility, which I've identified over the last decade of working with couples trying to conceive. So the link is going to be in the description below. Click on it to find out more. And otherwise, I have nothing left to say except see you next time. Bye.